It's Get Well Wednesday. Brought to you by the American Diabetes Association. Visit NoDiabetesByHeart.org to learn the top 4 questions to ask your doctor about diabetes and your heart. That's KNOW, Diabetes by Heart, HEART.org. Our doctor is Dr. Golden. Dr. Golden is calling from Baltimore. Good morning, Dr. Golden.
Good morning. How
Currently
are you?
serves as professor of endocrinology, diabetes, and metabolism at Johns Hopkins.
Yes.
All right, doctor. All right, you know the 4 questions to ask your doctor about diabetes. Can we start there?
Yes. So I think one of the important things to ask your doctor is, what is your risk for developing heart disease? Because heart disease is a leading cause of death in people with diabetes. So while patients worry about going blind and going on dialysis, they're actually more likely to die from a heart attack or a stroke. And then it's important to ask your doctor, what can I do to manage my risk factors for diabetes? So, how can I better control my blood pressure, my cholesterol, and my body weight?
Mm-hmm.
I think the other thing to ask your doctor is, am I on the right medications to really lower my risk for developing heart disease in the setting of diabetes? So I think those are some of the key questions to ask. And then the other thing is, what changes can I make to take care of my heart, and what changes can I make before the next appointment?
Common symptoms of diabetes: frequent urination, feeling very thirsty, feeling very hungry, even though you're eating.
Yes.
Extreme fatigue, blurry vision, cuts or bruises that are slow to heal.
Yes.
Tingling pain or numbness in the hands and feet.
Yes, those are all symptoms of diabetes. So if you're experiencing any of those, it's important to get to your doctor right away and be tested for diabetes.
All right, and heart attack symptoms.
Yes.
Of course,
so
chest pains, discomfort.
Yes. And so with the chest pain, so it's often, it can be different in different people, but it's often like a crushing chest pain, sort of feeling like you have a heavy weight on your shoulder, and it may radiate to your neck, down your arm. Patients may feel sick to their stomach, so nauseated and have sweating. If you have anything that resembles anything like that, it's important to call 911 right away and have yourself checked out by the nearest emergency room.
And the signs of a stroke?
So the signs of a stroke are things like face drooping, weakness on one side in the arm or leg, sudden difficulty with speaking, so slurred speech, inability to form sentences. Again, this represents an emergency, so it's really important to call 911 and get to an emergency room right away.
And can you talk about the differences that may occur between men and women regarding some of these symptoms, especially I know for a heart attack?
Yeah, so one of the things is that for women, the symptoms of a heart attack often are what we call atypical. So the pain may actually not radiate down the left arm. Typically, it may radiate down the right arm. It may be more like sort of upper abdominal pain or pain in the back as opposed to chest pain. So, anything to a woman that doesn't feel right, it's really important for her to call 911. And, to give you a personal experience, I had an episode of atypical chest pain in January.
You
because
did?
I did. Because I have a family history of heart disease, I asked my husband to call 911. Everything ended up being fine, but I did go to the nearest emergency room just to make sure. So if you have any doubt in your mind, it's really important to call 911.
And as far as a stroke, if you are with someone and it appears that they're not right, what are the signs that we're looking for?
So the things I mentioned, it's the sudden onset of, drooping of the face, weakness on one side, inability to talk, slurred speech. If you see that, it's important to call 911. And the reason for both a heart attack and stroke, it's important to get care right away, is that we have treatments that if they are really, those interventions are done, within the first couple of hours of the onset of symptoms, it can really reverse the bad consequences of a heart attack or stroke. So that's why if there's any doubt, get to the emergency room right away.
Those sounds like symptoms of Laker fans last night.
Oh,
Well, that can happen.
Yeah. Good for you, doctor.
stroke it out.
My face was open.
Diet. Before we leave, diet.
Yes.
How important is diet, and what about a vegetarian diet or a vegan diet?
Right, so diet is extremely important. So because our appropriate diet helps us with weight loss, and so what we recommend is we do recommend a diet that is really enriched in in plants, fresh leafy green vegetables, good salads, and things like that, and sort of lowering like your processed sugars and things like that,
Right.
because we know that those like green leafy vegetables are helpful in lowering cholesterol and also helping to reduce body weight.
All right, doctor, you're going to be around to answer questions?
I will.
Okay, doctor. I know most of us listening have diabetes, so you're going to get a lot of
Yes.
questions. I don't know what time your first appointment is. You might have to move it back.
Okay.
All right. Thank you, Dr. Gold.